Now, this last category can be situations that are very manageable for the surgeons and the patient, or they can be very difficult, and that is revision Asian eyelid surgery. Now, revision surgery for anything can be a challenge. It doesn't matter if it's, it could be anything. Rhinoplasty, facelifts, eyelid surgeries, otoplasties, but in my case, I do Asian eyelid surgery every day, and so I see a wide spectrum of revision cases to do, and many of my revision cases are my own. Any surgeon who tells you that they don't do revisions of their own surgeries or some modifications of their surgeries either doesn't do the surgery often enough to have that issue come up, or they are just lying. End of story. Revision Asian eyelid surgeries, it can be something pretty simple. Maybe one crease that you created is a bit loose, or the creases are kind of asymmetric, or the patient actually liked the outcome, but they, in the end, 6 months later, 12 months later, they feel like they just want to alter it a bit, maybe raise it, maybe turn a tapered crease into a parallel crease, something of that sort. Those are manageable situations. But then you get into situations where patients are coming in to see their surgeon and they have had 2, 3, 5, 7 surgeries, either with the same surgeon or multiple surgeons, sometimes in multiple countries. And similar to more advanced age, complicated ptosis surgery, age-related surgeries, these more complicated revision Asian eyelid surgeries are going to require more time. Instead of it taking me an hour to revise your surgery or for me to perform surgery on you, it could take 2 or 3. I might be taking skin away. I might be putting skin in. I might be putting fat into your eyelid either through injection or even using a composite full piece of fat that's mixed with some fascia and laying it into that upper eyelid space through an external incision. I might be performing a ptosis repair. We might be grafting fat to the temples, the lower eyelids, the brows, just to get things to look a little better and a little more symmetric. It can be a lot of work, and one of the unpleasant realities of surgeries that require more time and more work is that they typically cost more. Your healing time is usually longer, and the reliability of the outcome, the likelihood that you're going to get the outcome that you're looking for, starts to go down. The more surgeries you've had in the past, the older you are, or just the more work and technique it requires to try and get you to a point where you're happy with the way your eyelids look. And sometimes you can't even really get to a position where you're actually happy with how the eyelids look, but you're happier. At least it's a less of a distraction. Or maybe you actually have some dry eye or tearing eyes or some medical issue related to past surgeries, and the best you can hope for is improvement of your symptoms. So if you have had more than a few surgeries in the past and you think your issues are pretty severe and you have any medical related issues that have come along from your past surgeries, you need to set your expectations appropriately. Your surgeon will not be able to make you happy. Your surgeon, if they're good at their job, should be able to make your situation better. And sometimes they make it a lot better, and you do get some joy and you do get some relief out of that. But if you have a severe case that requires a lot of work and you having to travel somewhere else in the country or somewhere else in the world for special expertise, just be prepared for a situation where you're happier with how things are going. You feel better, or at best, you're just less distracted by the issues that you're having with your eyelids. And hopefully you don't end up in a situation where you are worse off than you were with your last surgery. I can't tell you how often it happens that a patient goes into an office, and if they have the money and they have the time and their credit card is out, surgeons will say yes to almost anything that they ask. So probably even more than the other categories in Asian eyelid surgery when it comes to complicated revision Asian eyelid surgery, or even the simple ones. So go to someone who is open about, one, the surgeries or the revisions on their own patients, and they can show evidence of that, or even there's evidence of their work out there on the internet, YouTube, Instagram, or their website, and you can see that work has been done before you ever go in for a consultation. 2, you need to go in to see someone who sets realistic expectations for you. Ask them specifically, have you done cases like mine? And can you show me something similar to my situation? Most surgeons can't find a case that is just like yours, but if they've done it enough, they can find cases that are something like yours. So don't be shy about asking a surgeon, even if they've been on TV and they're well known or they're famous or they charge a lot. Ask them really bluntly, can you show me cases like my own that you've done in the past? If your surgeon that you're talking to is in their early 30s, they probably don't, because they're a little early on in their career. But if they're well into their 40s or 50s or 60s, and you're asking them for evidence of cases similar to yours and they just can't find anything, you're probably in the wrong place. Now, finally, if you are seeing surgeons who can show that they have done the work similar to yours, or they have a body of evidence, a body of work that clearly they've done revision cases similar to yours, they know what they're doing, and after the end of the consultation, they look at you and they say, you could get surgery, and it might be an improvement, it might not. But my suggestion to you is either 1, don't do it, or 2, give it a lot of time. Listen to that surgeon, okay? Especially if you've talked to, say, 2 or 3 surgeons with very good reputations and a lot of evidence to support that they do these procedures. If they're telling you to wait, if they're telling you to do nothing, you might want to listen to them. Don't keep going and getting consultations with surgeons until someone says, yes, I can totally fix this for you. I'm your guy. A lot of patients get themselves into some pretty serious trouble just looking for someone who says yes. So if it's clear they've done a lot of cases similar to yours, and their suggestion still is maybe just to leave it alone or give it a lot of time, please listen to them.